Hey everyone, welcome back to my page. I'm Dr. Sam. Last week I posted a poll on my Instagram page to see what topics you may be interested in as it pertains to men's health. A lot of you guys mentioned that you were interested in learning a little bit more about the anatomy of an erection. Now, hold on. When I say anatomy of an erection, I don't actually mean the anatomy of a penis. I'm not going to get into the nitty-gritty of veins, arteries, nerves, everything in your penis, but actually really focus on the anatomy in which an erection functions. So today, that's our priority. Now, I did want to start out with a fun fact that you may or may not be aware of, but many of my patients tell me that they are unfamiliar with this because it's something that they've just never had to think about in their life. But anyway, since we're talking about the anatomy, I figured I'd go briefly into the anatomy of a penis. Well, believe it or not, your penis consists of two completely different muscles. There's a muscle in the shaft of your penis, and then a muscle that is located in the tip of your penis. And if you could believe it, those are two completely different organs. It's almost like if you were to take a mushroom top, connect it on top of a tree stalk, and call it a penis. It's quite interesting. Both those organs actually have different blood flow from different arteries that go into those areas. It doesn't really matter for what I'm going to tell you about today, but that being said, it's just a fun fact for you. Anyway, so to get started, now, we're going to go into the anatomy of an erection, and there are really four major components that are important in order for you to get an erection that's hard enough to complete sexual activity. The first big part of an erection is actually the muscle in your penis. The muscle in your penis is called the corpus cavernosa, and that muscle is a smooth muscle that requires it to relax in order to fill with blood. Now, in order to keep your muscles nice and strong, you guessed it, you have to exercise. Well, I'm not talking about just going to the gym and lifting some weights. I'm actually talking about utilizing the muscle. That saying, use it or lose it, couldn't be more true. Now, when you get blood flow, stretch, and oxygen into your penis, you're actually getting that pump inside the muscle in order to keep it really healthy. So guys, keep utilizing that muscle and keep it strong. It's just like any other muscle in your body that needs that oxygen in order to function. The second major important component of an erection is actually your vasculature. Now, I'm talking about the arteries and veins that are located inside the penis. Now, when you think of an artery, it's exactly what you may be picturing. The artery dilates, it opens up, and allows blood flow to stay inside the penis. Once the blood flow goes inside the penis, the muscle expands, right? Because we talked about smooth muscle relaxation, and it expands, and it starts to compress the veins that are located in your penis to allow for the blood flow to stay inside the penis. So what does that mean for you? Well, you need really healthy arterial function in order to get that clean oxygenated blood flow into your penis. So how do you get clean blood flow? Well, exactly the way that you would think of how your heart gives you clean blood flow throughout your body. Exercising, eating healthy, really taking care of yourself. You may recall in the former video that I did that I talked a little bit about how Viagra helps with endothelial tissue protection. And that's just basically supporting the tissue that supplies blood flow to your penis. Well, what does better than that? Actually taking care of your body, making sure that you're exercising, making sure that you're getting adequate amount of sleep, and making sure you maintain a really healthy weight. A third component of a strong, healthy erection is just making sure that your nerves are intact. And yes, the nerves that I'm talking about are nerves that are inside of your penis. So what do I mean by that? Well, when you think of nerve function, I'm sure you think of nerve function as it pertains to the way that your body operates. Well, there's something called sensory and motor nerves. Now, in order for the penis to function well, you need to have good motor nerve function. In order to feel sensations, you need to have good sensory nerve function. So what does that actually entail? Well, the nerves are the entire component that begins the cascade of the erection. It's the signal. If you think of how a heart fires, it's that firing mechanism. And it's that mechanism that allows the entire component and cycle of the erection to begin. Well, what can really hinder your nerve function? Two big things come to mind when I think of poor nerve function. Well, one, unfortunately, I'm sure you know, maybe a dad, brother that has gone through some pelvic surgery related to cancers like bladder cancer or prostate cancer, where they've really had to manipulate nerve function and has made it really difficult for that person to operate mechanically and get an erection. Well, that's because their nerves are usually damaged or they're obliterated completely during the surgery. It's always good to get a good surgeon that knows what they're doing. The second big one that comes to mind in the regular day-to-day activity of men is really diabetes. Now, when you go to your primary care provider, a lot of times your doctor will say, are you having any numbness and tingling in your hands and feet, especially when you have elevated glucose levels? What they fail to ask you is, are you having any changes in your erectile function? Are you complaining that you are having that inability to start that cascade of getting an erection or keep an erection or get hard enough for even penetration purposes? Well, what is the recommendation here? Well, to start early, right? To keep eating healthy, to limit your sugar intake, and to exercise. So nerve function is number 3. So for the fourth piece of a good hard erection, I actually think this is one of the most important components, not negating the importance of the other 3, which are essential in order to give you a really hard erection. However, this to me seems to be the most important, because without brain function, without that ability to actually get into the moment, you're going to fail at even initiating that nerve function to fire off all of those good feelings. Now, what do I mean by this? Well, I want you to think of a time in your life where you were the most scared you've ever been. And it could be any scenario where you felt scared. I'm sure you can imagine you didn't have an erection at that point. Your eyes were dilated, your heart was racing, you're breathing as fast as you possibly can. And it's basically your body's way of saying to you, I need to fight, I need to flight. Having anxiety and performance anxiety gets the same mechanical reaction and same chemical reaction as a fight or flight moment. These fight or flight moments do not discriminate. So when you are in the bedroom and you are not feeling relaxed, or you're feeling stressed, or you had a hard day, or you're just not aroused, give yourself some grace. It's okay. Take a step back and maybe return to your event at a next time. But just know, if you're not in the mood or if your brain capacity is not there, you will not be able to get an erection. So as you can see, the 4 really important components of getting a good hard erection is having a good functional muscle, healthy vasculature, good nerve status, and of course, being there in the mood and in the moment. I know that's not the case for everyone, and I know that sometimes that's really hard. So if you tune into one of my future videos, I'm more than happy to fill you in with some more tips and tricks on how to improve your erectile status. But for now, thanks for tuning in. Have a great one. See you next week.